Hello, thanks for joining me for Brioga. I'm excited to be here with you today for a roughly 20-minute series, a general series, intermediate, to align your body, neutralize your pelvis, extend your thoracic spine, and create balance and alignment in your body, stuff that we all need. We're going to need a strap and a large block or a pillow. The first one we're going to start off with, I call straps. I'm going to have you lie on the ground, place your strap, belt, any object that does not stretch that you can tighten to about 1 fist of width between your knees. Fasten it if it needs to be secured, and then lie down on your back. Knees bent, palms up beside you, big toe pressure. And notice how your hips are on the ground, and leave them just like that as you keep your big toe pressure and press out on your strap. You really want to avoid rolling your hips forward or backward or lifting your back up or pressing it into the ground. Everything stays still, your hips are just activating to press on the strap while you're maintaining your big toe pressure. We want to do it about 30 times. We want to press for about 2 seconds each time. As you get the hang of it, you can really press as hard as you want. You can apply a lot of strength to this activity if you like. Since our knees are in a strap that doesn't stretch, as we're pressing, our body is naturally going to find a balance in the activation of our hips. Our body isn't going to send both legs over to the left or over to the right. It's going to keep them right in the middle, and it's going to change what it's doing to make that happen for you. Easy trick, big result. As you activate your muscles in this way, if your pelvis is not in alignment, it's going to pull it there. Checking with your toes, make sure they're still pressed. Pressing out even more firmly with your knees now as we're finishing up. Just a few more left. And then we're going to slip our strap off and set it beside us. We're going to get our pillow or our block. You really want it to be about 5 inches wide. And it shouldn't squidge much less than 4. That can really make a big difference. So get your biggest cushion, get a paper towel roll, detergent bottle with the lid on it, anything wide enough. Big toe pressure, hands out, palms up. Then we're going to squeeze. Same rules, don't roll your hips up or down, don't roll your back up or down. And relax, holding for about 2 seconds each time. Exhaling fully as we press. Inhaling deeply as we begin to relax, but not enough to drop our pillow or our block. as we squeeze our pillow, again, we're tricking our hips into creating an engagement equally. Our body's not going to push our legs to the right or the left as we press. So as you do so, you're going to use your hip flexors and your adductors exactly the same way on both sides, even if it feels different. And then your pelvis will be pulled into a neutral position, which is ideal. And then you can set your pillow beside you, and we're going to rise up onto our knees. Now, if you have sensitive knees, you may want to get something to put your knees on top of, on the ground, because we're going to stand on them. I'm going to have you take your pillow or your block, get it right between your feet, hold it with the entire inside of your foot, with your knees a little extra wide, put your hands on your hips, and push them forward so they're right under you. Now, see if you can get 2 fingers on the front of your hip bone and your thumbs kind of on the side or back of your hips, and now you have your pelvis in your hand. If you feel your thumb go up when you do this attività, that's not good. You need to keep your hips tucked down so your pelvis is neutral. You're going to press your big toe and your ankle in on your pillow. Feel the squeeze in your glutes. And then relax. Now if you're feeling it a lot in your hamstrings, make sure you're pressing with your big toe, and also make your knees a little bit wider. We're going to hold it for like 2 seconds at a time, and relax. We want to do about 30 of these also. At this point, your glutes should feel extremely active. Your pelvis should still be neutral. Your hips have not tilted up in the back or down in the front. You're wondering how many are left. Let's do 3 more. Squeeze hard with your ankle and your big toe. Great job. Now we're going to set our pillow or our block beside us. See if you can get yourself on your side with your knees up at a right angle. So knees are right angle, hips are at a right angle. I'm going to have you put your hands out in front of you. Bend one and reach over your body and let your arm dangle behind you. And try to look right at your hand. Make sure your knees are still perfectly together. On the hand you're not looking at, try to keep all of your fingers and thumb on the ground. And elbow, breathing very deeply, exhaling all the way, dropping your belly button to your spine. And you should notice your arm resting more fully or closer to the ground. And this is a great activity time because it's keeping our pelvis in a neutral position and allowing our spine to twist semi-passively. We're just falling into it and letting it work itself out. And then we're going to bring our arm back over our body, bring our hands to touch, and then we're going to flip over to the other side. Make sure your knees are up, your knees are matched up, your hands are together in front of you, make sure your back is pretty straight. Bend your bottom arm and open up the top and look right at it. Make sure your knees are matched up, squeeze them tightly together. Back of your hand you're not looking at is flat on the ground. Thumbs, fingers. Taking deep breaths, trying to keep your hand slightly above your shoulder as opposed to below it. Above. Breathing deeply. Exhaling fully. Probably notice one side is easier than the other, and that's pretty normal. As you manage your posture regularly, you should expect to notice that that difference becomes less over time, the longer you manage it. And then bring your arm back over your body. Bring your hands to meet. And then you can roll onto your back. We're going to do an activity called struggle bug. You're going to hold your lower back extremely flat to the ground. This is going to help our hips come out of an anterior tilt and stay that way. It's also going to brace our core a lot. We're going to point our hands up and point our knees up, keeping our legs at a right angle. And we're going to keep our back absolutely flat to the ground. We're not going to let that go at all. You're going to open up your opposite hand and foot. Don't straighten your leg, just set your foot on the ground and then come right back. Keeping your lower back absolutely flat. Inhaling, opening up, tapping the ground, returning to the starting position every time. Don't move your opposite hand and leg until you have fully assumed the starting position. And we want to do about 10 each way. Keeping your back absolutely flat. Belly button drawn to the spine. I think that's good. And relax your legs. We're going to return to standing. We want to put ourselves on the wall. We'll find our heels about 6 inches apart, touching the wall. Put our hips evenly on the wall. Put our hands evenly on the wall. Our shoulders on the wall, rolling them back if they need to be. And then we're going to put our thumbs and especially our fingers on the wall. Don't force your head to the wall if it's not touching naturally after doing those other things. If you want, you can squeeze your butt and hold it to keep your pelvis in a more neutral position. Possibly making some big toe pressure. Always holding the thumbs to the wall. Breathing deeply. Embracing the challenge if you're having one. And we'll maintain this position for about 2 minutes. Giving your body a vertical surface to respond to, and enough time to do so will cause it to adapt to support your position. The muscles holding your bones a particular way are going to start holding them a little bit differently, so that holding yourself to the wall is less effortful. Your body responds to pretty much anything you do with it, the positions that you spend time in, the work that you do, the movements that you make. Your body is always trying to specialize itself to your needs. So in order to change what your body's doing, you need to change the way that you're treating your body and tell it what you need it to do. Spending time in end range positions, in positions of mobility, managing your posture and spending as much time as possible with a neutral pelvis, activated glutes, extended thoracic spine. This is going to help you thrive in a world where the opposite of all those things is kind of encouraged. Sitting is really bad for you. When I work at the clinic, I would say 90% of the people that I'm seeing there as patients, I'm seeing because of the time that they have to spend sitting. It's really sad to think about. But don't let your thumbs off the wall and take deep breaths. Let's take 2 more of our deepest breaths. And then you can step off the wall. Now your body's position should be pretty restored, good to go for the rest of the day. Thanks so much for joining me. If you feel good right now, please consider liking, subscribing, and sending this to a friend or a loved one that needs it. Thanks for joining me.